Hey everyone, Dr. Tom Sellers from Sellers Sports Medicine and Family Practice. I got a couple really interesting topics for you guys today. Two procedures that we do with ultrasound guidance, the suprascapular nerve block and the shoulder hydrodilatation. These are wonderful treatments for frozen shoulder or adhesive capsulitis. Frozen shoulder can take a long time to heal and get better. Most cases, 1 to 3 years in terms of disease course until people start getting better. That's unacceptable here at Sellers Sports Medicine. We got some really awesome procedures to try to shorten that tremendously. Let's dive in. First, I'm going to talk about the suprascapular nerve block. This procedure is, of course, under ultrasound guidance where we go in with a needle and inject lidocaine around the nerve. So we anesthetize or block the nerve. This nerve is responsible for motor function to the supraspinatus and infraspinatus, as well as sensory function to these areas and sensory function to some of the shoulder capsule, as well as the coracohumeral ligament. And some of these are implicated in the pathophysiology of frozen shoulder. Let's review a video of the procedure and talk a little bit more about it.
Let's get more acquainted with the anatomy. So here we have the suprascapular notch and the superior border of the scapula. Overlying the suprascapular notch is the transverse scapular ligament, and right in between the ligament and the notch is the suprascapular nerve. Over here we see the needle coming down right into that space. Here's the actual procedure where we see that lidocaine bathing that nerve, especially the superficial or superior aspects of the nerve. Here's a continuation of the procedure where we redirect the needle and address the deeper or inferior parts of that nerve to really give it a circumferential lidocaine block.
Now let's talk about the shoulder hydrodilatation procedure. For this procedure, the problem with frozen shoulder, really, one of the main problems is that we have a thickened joint capsule. It's tight, it's sticky, there's reduced joint volume, so we're trying to reverse that. We're doing a high volume saline with lidocaine into that joint under a firm amount of pressure to expand that joint capsule and lift it. This can provide more range of motion and some propensity to heal this faster. Once we do this procedure, we try to get you into physical therapy to get that range of motion going, to get strengthening, because without proper range of motion, very hard to heal, very hard to strengthen that joint. All right, so let's dive into the video and we'll talk a little bit more about the procedure.
Let's establish some anatomy. This is the glenohumeral joint, delineated by an H and a G, the ball and socket. In between is the joint space, and overlying this is the joint capsule. You see the needle actually coming in and entering the joint space. Now on to the first part of the procedure. We see the needle in the joint space injecting some lidocaine. You can actually see some flow of that injectate in the joint space. Now we are injecting saline with lidocaine with a sizable force into that joint space. Now we are injecting more saline into that joint space, and we're really seeing a big separation of that shoulder joint capsule away from that humeral head, which is, you can see that fluid in that joint space, giving a lot more room for that joint to move.